We can come together to solve the housing affordability crisis. Thank you.
Hello, I'm Councilwoman Laura Pastor from Phoenix, Arizona. I'm happy to join you at this year's Congressional City Conference, where we'll discuss ways to partner with the federal government to help rebuild our nation's crumbling infrastructure, continue to connect our regions, and create new sustainable technology solutions. Before COVID-19, we knew much of our nation's infrastructure was in dire need of repair, improvement, and modernization. The pandemic has forced local government budgets to either delay or cancel critical infrastructure investments. This is why, now more than ever, the federal government must prioritize infrastructure development, not only to repair our nation's deteriorating roads, bridges, railways, and ports, but to spur job creation and local activity to move our nation's economic recovery ahead. We must also ensure our residents have full broadband access to stay connected, not isolated while social distancing. We need America to get back to work and urge our federal partners to support our communities with grants, tools, and resources for infrastructure projects. And I look forward to working with all of you in keeping America moving now, generations to come. And in the words of one of the nation's greatest civil rights activist Dolores Huerta, si se puede.
Please welcome Representative Peter DeFazio, Chair of the House Transportation and Infrastructure Committee.
You know, it's a new era. We went through 7 fake infrastructure weeks with Trump. The net proposals out of the Trump administration would have cut investment in surface transportation. DJ Gribben would have said, hey, it's the responsibility of the states and the localities. That doesn't work. I have a poster. Many of you have seen it. It's it's a visual shot from Life magazine, 1956. And it shows a brand new ribbon of concrete. That's the Kansas Turnpike. And it ends in like all these kind of lines. And you go, what's that? Oh, that's Amos Schweitzer's farm field. Oklahoma promised to build it, but they got in financial difficulty and they couldn't until we had the Eisenhower plan. The Eisenhower plan was great for the time, but it's time to move beyond the Eisenhower plan. I'm not doing Eisenhower plan 7.0. This is the 21st century in America. We have all incredibly new challenges and threats, including climate change. And we can deal with economic recovery, climate change, and rebuilding our infrastructure all in one bill with your help. My bill would invest $500 billion over 5 years, 44% increase, $49 billion dedicated to local areas. I know that a lot of times you struggle with your states to get the funding you need for meritorious local projects. We're going to direct more money down to your level, $105 billion over 5 years for transit and transportation programs. We're going to have locally driven discretionary grant programs to communities of all sizes, and a new metropolitan performance program to provide flexible federal funding directly to regions, options that go beyond the car, truly multimodal, micromodal. All those things are in this bill. We have a Secretary of Transportation who was a mayor. He knows about complete streets. We're dealing with appropriate design and complete streets in this bill. We've got to help people get out of their cars, and more people will get out of their cars if it's safer and more convenient to use active transportation other than an automobile. And more people will get out of their cars if we have dependable, more accessible, and more frequent transit. With a $100 billion backlog for a state of good repair, people don't take it. They say, hey, I got to be at work time. Train broke down. Sorry, boss. No, it doesn't work. So bring it up to a state of good repair and extend new transit options to people, all at the same time as we defossilize. We've got to move beyond the fossil fuel economy, the largest contributor to fossil fuel pollution in the United States of America is transportation. This bill will deal meaningfully with that by electrifying the National Highway Network. We're going to partner with the Energy and Commerce Committee. We want to have electric buses in cities. Electric semis are coming. There is no charging station anywhere in America for an electric semi right now. And there's only 5,000 high capacity chargers for individual vehicles, small trucks, et cetera. The president's talked about 500,000 chargers. I don't know if that's enough, but we are going to do this, and we're going to do it with renewable power. You don't gain a lot when you charge your car from a coal plant. You gain something, but not what we want.
Greetings, I'm Mayor Lyle Jordan from Fayetteville, Arkansas. I'm looking forward to speaking with you all at this year's Congressional City Conference to discuss getting America back to work. To do this, we need to see policies from the federal government that will ensure our communities play a central role in our nation's economic recovery. Both before and throughout the pandemic, we've seen the nature of work rapidly evolve that have completely transformed our economy. In response, cities need enhanced workforce training programs to ensure that we are prepared to take on the jobs of the future. More Americans prepared to return to work after historic levels of unemployment. We want to see a federal government that provides apprenticeship programs, expands financial aid programs for workforce training skills, and creates new pathways to successful careers for unemployed and underemployed Americans. Here in Fayetteville, our latest library expansion includes a new innovation center where access to job skill training opportunities is as easy as checking out a book. The center includes a teaching kitchen, makerspace, robotics lab, audio and video editing suites, all at no cost to our residents. By investing in skills training and wraparound support for working families, the federal government can help city leaders build upon successful workforce development programs that strengthen our communities. At the local level, cities are counting on Congress and the Biden administration to empower local workforce solutions so that all of our residents have an opportunity to achieve meaningful employment at a living wage. Thank you all.
Hi, I'm Rich David.
I'm Kathy Sheehan.
I'm Francis X. Murray, Mayor of the Village of Rockville Center.
Mayor of the City of Albany, New York.
Mayor of the City of Binghamton. We have been on the front lines of protecting our community during this pandemic.
Providing essential services and taking extraordinary steps to keep our residents safe.
Yet all of America's villages, cities, and towns are struggling, not because of anything that we've done,
but due to the pandemic and the economic shutdown it created.
We need help. We have done our jobs during this pandemic. We have continued to provide all the vital services.
On top of our current financial struggles, it's projected that over the next 3 years,
municipalities like ours across the nation
will see over $360 billion in lost revenues,
leading to budget cuts, service reductions,
and job loss.
These losses aren't just numbers. They will be our families,
our friends,
our communities, and frontline workers.
Providing direct and flexible aid to municipalities
is the most effective and immediate way to help families who have been suffering for far too long.
The aid will allow us to maintain our significant contribution to our local economy
by preserving critical public sector jobs
and supporting local businesses.
I believe unemployment prevention and relief must be a key part of the upcoming COVID relief package.
Leaving local aid out of the package will only lead to greater unemployment.
Community needs should not be painted in partisan terms.
Red, blue, or purple, all states, all municipalities
are feeling the pain that has been caused by this pandemic.
And every state in the nation
has communities that look just like ours.
The fact is,
Our community has been left out of each previous round of COVID relief.
It is way past time for Congress to step up
and provide direct aid to us, the municipalities.
America can build back better.
If local governments are supposed to lead the way.
Hey everybody, I am Randall Woodfin, and I serve as mayor of Birmingham, Alabama. It's been a year in many communities. City leaders have been working around the clock to keep our residents safe during the COVID-19 pandemic. This last year has shown the importance of efforts at the local and federal level to reform and reimagine public safety and policing to address longstanding inequities endangering our communities. We recognize another public health crisis in our neighborhoods, the epidemic of gun violence that claims many lives each year. Since the beginning of the pandemic, we have seen a rise in gun violence in cities throughout our nation. That violence threatens to tear apart the very fabric of our society. That's why it's important for local leaders to have the tools needed to take on this pandemic of gun violence. We want to work with our leaders in Washington to advance common sense solutions to protect our communities. The National League of Cities is encouraging the Biden administration to convene a national commission on gun violence that brings together stakeholders from across the spectrum to offer recommendations on ways to reduce gun violence in our hometowns. Now, make no mistake, the violence we are seeing in our communities is a public health crisis that demands action. We look forward to constructive conversations between local, state, and federal leaders on ways to enhance public safety in all of our communities. Thank you.
Please welcome back NLC President Kathy Maness.
CCC is always special for many reasons, but one of those is because it takes March, Women's History Month. Every year, I look forward to meeting my sisters in service, my fellow women in elected leadership. Our experiences are unique, and NLC's Women in Municipal Government gives us a place to come together and share those experiences. Learning and growing with each other has been so empowering. This is a landmark year for women in government. We have a record number of women serving in Congress, and in January, our country welcomed the first woman sworn into the White House for the first time in United States history. I don't know about you, but it still gives me chills thinking about it and what it meant for our nation. And now today, on National Women's History Day, it is my distinct honor to welcome to NLC and the CCC stage the Vice President of the United States, Kamala Harris.
Thank you, Council Member Kathy Maness, for that kind introduction and the spirit behind it. And to Mayor Clarence Anthony, the NLC board and staff members, local leaders, it is truly an honor to join with you today. And of course, as Kathy said, we gather at the start of an important week for our country. Yes, we are honoring the women of our country and the world, but this is also a week for our country that could mark a real turning point in our fight against COVID-19. Last weekend, as you know, the House of Representatives passed our American Rescue Plan. It is a plan that will provide immediate relief to America's cities, towns, and villages, and directly to the American people. This past weekend, the Senate advanced this landmark legislation, and very soon, the President of the United States, Joe Biden, will sign the American Rescue Plan into law. So for a year now, we have faced this crisis of almost immeasurable proportions, impacting the health of our communities, the livelihood of our businesses, and the education of our children. Through it all, local leaders, you have been in the thick of it. You are the ones who get called when there aren't enough vaccine doses to go around. You're the ones fighting to make sure first responders can keep their jobs. You are working with teachers and parents to get schools reopened safely. You are working with small businesses to keep their doors open and working at food distribution sites in what remains of your spare time. Being a local leader has always been a 24/7 job, and this year I know has tested the limits. And still, you keep getting up every morning and working to make things better. So on behalf of myself and President Biden, who I think you all know both of us served as local leaders, we thank you. We thank you. We thank you. The president and I were preparing to take office. We knew what you were up against. We knew we needed to be ready to go on day one. So we started working with you to put a plan in place to rescue our nation from this pandemic. I'm proud to report that we've made incredible progress. More than 80 million vaccines have now been administered. Last week, 18 million doses were sent to states, to pharmacies, and community health centers. Merck and Johnson & Johnson, competitors before now, are teaming up to speed up manufacturing, which means that we should have a full vaccine supply for adults by the end of May. And to get shots in arms more quickly, we've opened new vaccination centers in a number of places. In the place of my birth, Oakland, California, in Los Angeles, in Houston, in Dallas, in Arlington, Tampa, Orlando, Jacksonville, Brooklyn, Queens, and upstate New York. And one opened in Philadelphia last week. Others will open in Chicago and Greensboro this week. And another 2 are coming to Atlanta and Cleveland soon. So as you know, we've all been busy. And we're doing this, all of this, as I've mentioned, as we advance our American Rescue Plan. This plan is big and it is bold, and it will help us beat this virus and build back our economy. With this plan, we will scale up our vaccination program, get relief to the small businesses that fill your main streets, and get your schools safely reopened. The bill provides targeted support for as many as 19,000 cities, towns, and villages. And we know many of you are dealing with budget shortfalls as revenues are down and, of course, expenses are up. As a result, vital services have been cut, and I know you didn't want to, and we've lost more than 1.3 million state and local government jobs in just the past year. In the aftermath of the Great Recession, these kinds of cuts put a significant drag on our economic recovery. And guys, we can't let that happen again. The American Rescue Plan will also get $1,400 checks in the pockets of people who need them most, and a $3,000 tax credit per child. Think about it. This plan will actually lift 1 in 3 Black and Latino Americans who are living in poverty and lift them out of poverty. We will also lift half of America's children who are living in poverty out of poverty. I mean, just think about that. Half of the children in our country who are living in poverty won't be. So the American Rescue Plan, for that and so many other reasons, is, we are happy to say, incredibly popular. And the support for it is broad and it is bipartisan. 3 in 4 Americans support the bill. Democratic and Republican mayors and local leaders have endorsed it. And of course, so has the National League of Cities. And thank you for that. And think about it. 2 mayors, just most recently, a Republican from Miami and a Democrat from St. Petersburg, wrote an op-ed about why they support the plan. And they said in the op-ed, quote, "Our people need help." And as the president would say, Help is on the way. Today, the American Rescue Plan is very close to becoming the law of the land. And now we need to help ensure that relief is distributed equitably. And that means we need to acknowledge, as so many of us do, we need to acknowledge the pandemic has made worse the fissures and the flaws and failures that already existed in our systems and in our structures. We've seen that race and place matter a lot in how well protected a person is from the virus or not. And race and place have played a role in access to services. So one way we're addressing this is with our COVID-19 Health Equity Task Force. This task force stemmed from a bill I introduced in the United States Senate to have a dedicated group of experts who report on the disparities that exist in the allocation of resources. The task force is required to make recommendations on how to solve for those problems. And local leaders are vital. You are vital to the solution. So today we have a big announcement, and we're actually making it right here with you because it will have a direct impact on the communities that you serve. Our administration will offer $250 million in grants for localities to partner with community organizations on health literacy. Our goal is to provide underserved communities with the information they need to stay safe and to get vaccinated. And remember, information and education, of course, saves lives. When folks have the information and the education, they have the tools that equip them to take care of themselves and their family. We expect to fund 30 projects in urban communities and 43 projects in rural communities for 2 years. And I'm going to give you some information on how you can apply and get more. And that is to apply through April 20th at, and I'm going to give you a website, minorityhealth.hhs.gov. And we'll follow up and get it for you in writing. But I ask the friends here, please do work with us to put equity at the center of our collective response, to identify those individuals and communities who have been overlooked, and to connect them with the resources that are available, and to connect with them in a way that we renew and, in some cases, establish trust between community and those folks who are elected to serve those communities. And also, we've got a child tax credit coming that they can take advantage of. So please tell them about it. And tell them about the Paycheck Protection Program and the loans there for small businesses. Please tell your folks about how to get vaccinated at pharmacies and community health centers and mobile units. And please continue to tell everyone you know to wear a mask. And this brings me to my final point. The American people will continue to look to you as much as they look to me or the president because of your tireless efforts, because they know they can rely on you. They will continue to look to you for answers and for action and for comfort and for hope. And I know it's not an easy job, but what you do, especially at this moment of crisis, couldn't be more important. So thank you again for all you do. I know it takes personal sacrifice and sleepless nights, but know that the president and I are working right alongside you. So may God bless you, and may God bless America. Thank you all.
Join us in welcoming the Mayor of Huntington, West Virginia, Steve Williams, in conversation with U.S. Secretary of Transportation, Pete Buttigieg.
Mr. Secretary, welcome home. Glad to have you with us today. I'm honored to welcome you to the NLC's Congressional City Conference. And we have individuals here who are viewing this from Hawaii to Maine, down to Florida, and everywhere in between. And They recognize a familiar face because we know that prior to becoming the 19th Secretary of Transportation in January, I think it was just 33 days ago, you served 2 terms as mayor of your hometown of South Bend, Indiana. And we know in South Bend, you worked across the aisle to transform the city's future and improve the everyday lives of residents. We know that you're going to continue to do that in Washington. So Mr. Secretary, 33 days into it, how are you rolling up your sleeves and getting to work at the U.S. Department of Transportation?
Well, Mayor, first of all, it's great seeing you. Thanks for your continued leadership, and thanks for a chance to address everyone who's gathered with the National League of Cities. You truly represent the people who are doing the work, and the work you're doing is phenomenal, especially at a challenging time like this. For me, as you might expect, it's been a lively few weeks. We got to work straight away, and there's not been a moment to lose. I've been focused on engagement internally and externally. Internally, because there were about 55,000 employees here at the department, phenomenal public servants and people who have such remarkable experience and remarkable commitment to our mission. So I've been taking a lot of time, as a new city leader would, getting to know employees here and making sure that we're the best possible workplace and that we're aligned as best as we can to meet the mission. And there's been a lot of outside engagement, participating in events like this one that I'm thankful to be at. And of course, a huge focus on making sure in these first weeks that we deliver this rescue package that the Vice President was just talking about. The Senate vote brings us one big step closer. I want to thank all of you for the work that you have done to communicate to the public and perhaps educate many members of Congress about what this means in our communities. And of course, now we need to get this back through the House over to the President's desk with not a moment to lose. And then we have an opportunity to work on an economic recovery package that I am so enthused about the potential of. We're talking about a chance to build back better across the country. And to my way of thinking, there are moments that come along that you just can't dare miss, and we're in one of them, both in terms of the scope of the challenge, from our nation's reckoning over equity, racial and economic justice, to the climate crisis in front of us, to what COVID-19 has done to our communities and economies, but also the opportunity side, the national impatience to get something done. And the fact that the economic conditions and the political conditions, I think, have us very well aligned to come together and do big things when it comes to infrastructure. I know this is not the first administration to arrive with high hopes on what we could deliver in terms of infrastructure, but we're determined to take advantage of this unique moment, this maybe once every century moment that we're in, with your help in order to deliver. And so when I'm not around this building getting to know my new colleagues or engaging with elected leaders like you, I'm working to frame the right possibilities for that. And we'll be turning to you, of course, both to inform and we hope to communicate the importance of the legislation that may be materializing later on this year.
Well, Mr. Secretary, we are coming upon a 1 year into a crisis that's laid bare our equity issues related to our health structure, their economic structure, and even the fabric of our social structure. And you've just indicated it's a once-in-a-lifetime opportunity for us to be able to get things right the first time. So in that regard, how is it that the Department of Transportation might be able to identify that once-in-a-lifetime opportunity to transform our nation?
Well, as every local leader knows, issues of equity and justice are absolutely at stake in the choices we make about transportation and infrastructure. We know that the very same Americans, disproportionately Americans of color, who've been excluded by design through American history from economic opportunity, have also been those most likely to live in neighborhoods with inadequate transportation resources, or most likely to live in neighborhoods where highway projects and other investments, often with federal money, have actually made things worse by isolating people from one part of a community to another. We got a chance to do something about that. We got a chance right now to take our history into account, and even more importantly, to take our future on board as we make choices that ensure that access to transportation becomes a leveler, an equalizer, something that makes this country a more fair and more just place to be. By the way, this is something that can't be separated from questions of climate and environmental justice. A very simple example is that we know that some Americans are disproportionately likely to live close to highway thoroughfares that have worse air quality and are more likely to suffer from asthma and other conditions related to particulate matter in the air, which in turn helps to explain one of the reasons why we see disparities in who's most vulnerable to COVID-19. All of this is connected. The problems are connected, and so are the solutions. I'm especially energized by the president's call for us to deliver 40% of the overall benefits of this administration's investments to disadvantaged communities. We're calling it Justice 40, and the Department of Transportation has a huge role to play here. Again, this is something we can't do just out of Washington. It's got to be in partnership with local communities. But the bottom line is this is a top priority here at the department. It's a priority of the president. It's a priority of mine. And I know that as you work to make sure that your communities empower everyone to thrive, we're going to do everything we can to support you in that work.
So just how is the Biden-Harris administration organizing around Build Back Better? And what's included, and how would you be working with local governments on that?
Well, let me make clear, we're working now even before we get some of those big pieces of legislation through. For example, on the Build grant, formerly known as Tiger, and the Infra grant, formerly known as FAST. We're going to be working to make sure that those priorities are reflected even in the discretionary grants. You may have noticed this in the notice that went out to Infra if your community is applying for that program. But the Build Back Better package represents a whole new level of opportunity. At least it can. And that's what we're trying to build right now. So the way I describe it is we got a 1-2 punch, a 2-step plan. Now, step one is what we're in the middle of right now. The American Rescue Plan that is going to get shots in arms, get checks to families. It's going to help with things like transit because we've got that support for transit agencies and local government. It's going to be what we really need in order to get through this tough moment that we've all been in our communities and in our economy. Hopefully that's just days away from signature. And then we can talk about part two of that 2-step process. And that's where we have a chance, I think, to put together a vision to build back better that obviously goes beyond what I work on here in the Department of Transportation. It's really a nationwide and whole of government opportunity. But you can't talk build back better without talking about build, which is infrastructure. So what does that actually mean? Well, part of it is modernizing, introducing the things that we really need to get our infrastructure to a world-leading level. I just can't accept that American citizens are told to settle for less than a lot of people in other countries when it comes to the resources they have, whether it's right around the neighborhood and transit options, or whether it's traveling long haul with some of the things that we've been asked to settle for with the funding that goes into rail in this country. But as every local leader knows, this isn't going to get the job done if we're just looking at things we might want to add or introduce. We have to take care of what we already have. We have so many roads that are in tough condition. The ASCE, the American Society of Civil Engineers, just came out with that famous report card that they do every year. And once again, we're seeing that our roads and our bridges and other elements of our critical infrastructure are in rough shape. That's why we're thinking about the fix it first strategy a lot around here, which is to make sure that communities have the resources to take care of what you've already got and adjust it. Maybe there's some areas where, just as there are some areas where a road needs to get wider, there might be some areas where a road needs to go on a diet. We ought to help with that too, especially if it saves you on maintenance costs in the long run. So these are the kinds of things we're thinking about. But I'm not going to be sitting in a room here at the department and thinking it up on my own, nor does the president envision this being a strictly top-down enterprise. This is something that's got to happen in dialogue. And that's why the listening session I was able to have earlier with the NLC leadership was so helpful. And we're going to continue to be listening as well as speaking on how best to frame this opportunity, which again, I'm convinced is one of those things that comes along just once, perhaps in a lifetime, and make the most of that opportunity to provide the investments that American communities need. And then we got to make the case. we've got to sell it. Because as we've learned with this rescue plan, just because something has a commanding majority among the American people, Democrats and Republicans, and perhaps among American mayors and city leaders, doesn't always mean that it gets a rousing majority up on Capitol Hill. That's where the work of all of us doing that, persuading, that engaging is going to be so important to actually get something through.
And as you know from your history at South Bend, the communication from the local level to the members of Congress is the way to be able to get things done. Earlier today with the board of directors, you heard a full laundry list of what we're attempting to do with infrastructure. We're prioritizing sustainable infrastructure investment with both a safety and technology focus. So how can we partner together with the US DOT in these areas?
Well, as you said, local leaders are already thinking about and acting on opportunities around things like safety and the use of technology. What I think DOT can do is help provide resources, help provide insights, technology sometimes, and that integrated view where a department like mine ought to be talking to a place like the Department of Housing and Urban Development about how we can mutually support transit-oriented development. Just to take one example of the kinds of interdepartmental collaboration that aren't always part of the way people are used to doing things in the federal government, but as every local leader knows, you can't get anything done without it. Some of the things we're working on sound very technical. The notorious MUTCD, I'm not even going to try to state what it stands for so I don't get it wrong, but it's the Manual on Uniform Traffic Control Devices, I think. Somebody will tell me if I got that wrong. But you may know it as something that almost has the force of law because it lays out the standards for roadways and signage and actually a seemingly dry and technical thing like how that manual is written and what it calls for could actually have a lot of consequences in terms of how people get around, in terms of safety, even in terms of equity. And so we're going to be working on those technical dimensions as well as on things like the big legislation we think we might be able to get done. None of it happens without a rich conversation with local communities to hear what you're already doing on the ground and find ways to support it and to share what we're learning cross-pollinating from one community to another, something that NLC already does so well. We want to provide support for that kind of thing in our department too. As you said, you have the ear of your members of Congress too. They pick up the phone when a mayor calls, when a local leader calls. And that's going to be very important in order to make sure that we have that right kind of dialogue. So much is made of the relationship between the federal government and the states. But to me, it's the relationship with the local communities that is the most dynamic, interesting, and important in our federal system. And I'm going to be bearing that in mind on anything we might be working on, whether it's grand visions for upgrading the rail network in this country, or whether it's trying to use our research capabilities to give you better, cheaper ways to fill potholes that last longer, potholes being the enemy of every local official. So all of these things will serve our fundamental shared goals: safety, climate resilience, equity and justice, and of course, job growth and economic strength. All of those things are possible if we're working together on the opportunities that infrastructure and transportation represent. It's part of why I'm so enthused to be in this job.
We have just about a minute left, Mr. Secretary. Now, you're among just a few thousand of your closest friends here at NLC. What can NLC, what can we do to help you build a more equitable future and get more done for our residents more quickly?
Well, you're doing the work right now. So the first thing that we need you to do is to succeed and to keep at it. Let us know what you need. And I don't just mean the projects, although of course you'll be in that robust process of going to bat for the worthy projects that we can often help with federal dollars. I mean, let us know in the same way that you work with your stakeholder community to make things simpler dealing with the cities that you run. I want to do the same thing in this department. If there's some process here, some form that's 10 pages, but it could have been 5 and met the same goals. If there's some process that takes 2 years and could have been 6 months and had the exact same rigor in terms of environmental or other needs, let us know what that's like, because I want this to be a user-friendly department for our intergovernmental partners, and we will be all ears. Then, as we shape up that common vision, I'm going to be turning you to build public support and congressional support for big investments, because we know without the big investments, we're just not going to be able to get where we need to be as a country when it comes to our infrastructure.
Mr. Secretary, we're awfully proud of you. You have a friend in the NLC. We look forward to working with you, and thanks for being with us today.
Right back at you. You got a friend in the department and a lot of friends in Washington who admire the extraordinary work you're doing. Keep it up and let us know how we can help.
Godspeed.
We are now pleased to welcome Clarence Anthony, CEO and Executive Director of the National League of Cities.
Good afternoon, National League of Cities. Really honored to be here today to welcome two of our nation's leading physicians to our virtual stage today for an important conversation regarding the national strategy on COVID-19. Exactly 1 year ago, local leaders were gathered in Washington, D.C. for this very conference. We were very likely one of the last in-person conferences as the realities of the COVID-19 pandemic gripped our nation in days, weeks, and months to come. As local leaders, you've been at the forefront of the response to this deadly virus. And this conversation could not be more critical to you as local leaders. It is important for us to understand the Biden administration's view on the current trajectory of the virus, the strategy for vaccine deployment, as well as how we can continue to address the issues of health equity and vaccine hesitancy. Our guests are the familiar faces of the administration's response, and I am so pleased to have them join me here today in this important conversation. NLC, please welcome Dr. Anthony Fauci, who is director of the National Institute of Allergy and Infectious Diseases at the U.S. National Institute of Health, where he oversees an extensive research portfolio focused on infectious and immune-mediated diseases. He also serves as President Biden's chief medical advisor and has served under 6 presidents, starting with President Ronald Reagan. We also want to welcome Dr. Rochelle Walensky, who is the 19th director of the Center for Disease Control and Prevention and the 9th administrator of the Agency for Toxic Substances and Disease Registry. Prior to leading the CDC, Dr. Lewinsky served as chief of the Division of Infectious Diseases at Massachusetts General Hospital and a professor of medicine at Harvard Medical School. Good afternoon, doctors. How are you guys doing?
Very well, thank you, Mr. Anthony. Thank you for having me.
Delighted to be here. Thank you guys for being here as well. Let me start with you, Dr. Fauci. You know, nearly 50 days into the Biden administration, where are we today in terms of the rates of infection of this disease and your perspective on whether the worst is behind us?
Well, right now, even though we have seen over the past several weeks to a couple of months a sharp decline in the number of infections per day, which were as high as 300,000 to 400,000 a day. The sharp decline is good news, but the sobering news about this is that we've reached what looks like somewhat of a plateau in the diminution of daily cases, with the 7-day average being somewhere around 60 to 70,000. So the good news is that it was coming down. The sobering news is that it's starting to plateau a bit. And history with this virus has told us when you start to plateau at a level as high as this, which is about 60 to 70,000 cases a day, that you are by no means out of the woods, and you've got to continue to do the type of public health measures that we talk about all the time, the masking, the physical distancing, and the avoidance of congregate settings, particularly indoors. When you talk about the worst behind us, that could be possible because we have vaccines that are now available that are highly efficacious and safe. So the more people we get vaccinated and the more quickly we do it, the better off we are. But now is no time to declare victory because we still have a considerable amount of viral dynamics that we're dealing with.
Yeah, let me follow up on that because I do think that one of the things our delegates are asking us is about the variants. How do the variants set us back in cities, towns, and villages all over America?
Well, I wouldn't say they set us back. I say they provide a new challenge for us. The new challenge is that we have a situation whereby you have viruses that are circulating that are not the original type of virus. They have mutations which then make them be called variants from the original, which you call wild type. And what the variants do, that they sometimes elude the protection that you can get from monoclonal antibodies, which is a form of therapy. And they potentially, not every variant, but some can potentially evade some of the protection that is given to you by the antibodies that are induced by the vaccines that we're using. Also, some of the variants can spread more rapidly than the wild type virus. And some of them can even be more serious in the sense of making you more sick. So we take them very seriously. We monitor them. And if necessary, we will modify our vaccines to address them.
You know, one of the things that the president has done is taken significant measures to increase the vaccine supply to communities across the country, including, like launching a retail pharmacy program and a FEMA reimbursement program to states. So given these measures, how quickly do you think we can vaccinate most of the residents in America?
Well, the president has said that by the end of May, we will have enough vaccine to vaccinate everyone in the country who is available to get vaccinated, in the sense of adults and certain of a younger population in which the FDA has allowed vaccination for. How long it will take to get everyone vaccinated is depending upon a number of factors. One, our logistical capability of getting vaccine into people's arms. I would imagine that we could probably do that within a couple of months following the total availability of vaccine, somewhere this summer, I would believe. That is really very important. And I think that this is going to change a lot of what we can and cannot do, which I'm sure you'll hear a bit more from Dr. Walensky.
So, our municipal officials from all over America is trying to figure out what is the best role for them as it relates to these efforts and measures. What can they do to help this issue related to the COVID-19 response?
Well, Mr. Anthony, the local elected officials are the people closest to the grounds in your community. I imagine you were elected officials, many of you. Therefore, the community trusts you. The best thing you could do to help me, to help Dr. Walensky, to help all of the people who are trying to get our arms around this pandemic, as well as everybody in the country, is to get your citizens to get vaccinated when the vaccine becomes available, and encourage them not to pull back on public health measures prematurely. In other words, listen to the recommendations of the CDC regarding mitigation methods, wearing of masks, physical distancing. They analyze this. They have the best epidemiologists in the world. Listen to what their recommendations are.
Thank you, Dr. Fauci. And now I'd like to turn to Dr. Lewinsky. Thank you so much for being here today. Our municipal leaders are just so pleased to have this type of information from you here today.
Thank you so much for having me, Mr. Anthony, and to the national citizens. I know you all have put in an extraordinary amount of work and dedication over this past year.
Well, thank you. You know, according to the CDC statistics, 52% of U.S. population older than 6 months received a flu vaccine, including myself, during the 2019-2020 influenza season. If we vaccinated 52% of U.S. residents with the COVID vaccine, would that be enough? And what is CDC's target for vaccination?
It's such a great question, and everybody's looking at this target for herd immunity. How many people do we need to have vaccinated? How many people do we need to have protected so that if somebody with disease were to interact with somebody else, that person would be protected and blunt further transmission? The bottom line is no, 52% is not likely to be enough. We don't exactly know what the level is, and with increasing transmissible virus, as Dr. Fauci just discussed, we believe the level to be even higher than we thought over the summer. So people over the summer were saying somewhere in the 60 to 70% range. People are now talking somewhere in the 70 to 85% range. The bottom line is that everyone who is willing and wanting should roll up their sleeves and get vaccinated, and everyone who's healthy enough to encourage others to do so should set the role model to be to bring others into vaccination. And I say this for elderly people, I say this for immunocompromised people, I say this for people at the highest risk of disease. We really do need everybody willing to roll up their sleeves if we're going to blunt further transmission and get to herd immunity.
Now, that's very helpful to be able to get the public officials that kind of information. And I wanted to kind of focus a little bit in this issue related to the people of color, particularly Black Americans, who are experiencing more serious illness and death due to the COVID-19 than white residents in our communities. In 16 states that's been releasing data by race, white residents are being vaccinated at a higher rate, in many cases 2 to 3 times higher than people of color. How should local leaders be messaging about the vaccine in order to ensure their residents have access and take this vaccination, particularly in the Black, Indigenous, Latino, Hispanic, and other communities of color? Any advice to our municipal officials?
Yeah, this is such an important question. And what I will say is, we at the CDC, I personally would really like to emphasize how critical this is. I know that the administration is deeply concerned about these inequities. Let me give you a few statistics. We know in this pandemic that Latinos and Hispanics are 2.3 times more likely to die, and African Americans 2 times more likely to die of COVID-19. We know data from the CDC over this past, first 6 months of this pandemic, the life expectancy dropped 1 year for all Americans. Life expectancy dropped 2.7 years for African Americans and 0.9 years for Hispanic Americans. And we know, as you point out, that while 65% of people, 65% of vaccinated are white, only 9% are Hispanic and 7% African American. These inequities have been deep, they have been longstanding, they're resulting in disparate health outcomes, and we have to fix this. We have to fix this because this is where the virus is, this is the communities that they are hitting. What I do know is that we need to use all capacity in order to do so. The federal government is working with FEMA and with the CDC to ensure that our community vaccination sites, our high volume 6,000 person a day vaccination sites, are strategically placed in high census areas with high social vulnerability indices. We're putting the federal pharmacy program in pharmacies where we believe they're working to reach the hardest hit communities. We're putting vaccine in federally qualified health centers for exactly the reason that you know, that serve the marginalized housed as well as publicly housed. So we're working really hard to make sure vaccine is getting to these people. But what we also need to make sure is that you, community members, localities, people who know your district, people who know your people, mobilize your networks, because they don't necessarily want to hear from me. They want to hear from you, trusted people in their communities, community-based organizations, faith-based organizations. And the more people in those local organizations that get vaccinated and that serve the example for others, the more people will want to be vaccinated.
Well, I can say on behalf of the National League of Cities, our members are so committed to making sure that everybody has access to the vaccine and that there's education to build that level of trust that is needed in the communities of color. So we are with you 100%. I want to ask both of you this question. You know, how is the administration thinking about issues of access a little bit more granular? And why I say that, in many smaller and more rural communities, and also in urban areas, access to broadband sign up for the vaccination is very limited. And a streamlined system to find out where to get the vaccine can be complicated. Are there ways that local leaders can help to best address this issue for residents?
You know, I will say that we know we've had numerous challenges with the access. One is that we simply have had not enough supply of vaccine. And so we, as Dr. Fauci noted, we know more supply is coming. We think that that is going to improve dramatically in the weeks ahead. We also know that there's a remarkable amount of vaccine hesitancy, and we really, really need to reach people where they are with regard to why they are hesitant. Some it may just be because it's not convenient for them. They haven't been able to access it digitally. They haven't been able to make the appointments or to sit by the computer to try and refresh and sign up for these appointments. Some of it is because they might not have understood how it was possible that the science moves so incredibly fast, and it did, with over 100,000 people enrolled in these 3 vaccine trials. Some of it is they're worried about their side effects and really just need to hear from others who've been vaccinated that they did not have severe side effects that they were concerned about. And some of it might just be convenience. They need to have a mechanism that's after hours, after work, on the weekend. So all of these things together, once we have more vaccine, I think will really be instrumental in getting more vaccine to people. I'm really heartened by some of the things that I've heard in the community, ways that communities react to their community members. In the city of Chicago, there were vaccine clinics that for union members of community colleges. In Loveland, Texas, there were vaccination centers at a new public transportation center. And in the Metropolitan International Church in Nashville, Tennessee, the faith-based efforts reach their communities of color. So these are just 3 examples of how really it is going to be person by person, community by community, that actually does this extraordinary outreach to get people vaccinated.
You know, and the president has also made it very clear that equity is always on the top line, front burner of everything we do. And if you look at some of the things that have already been put up, we're standing up community vaccine centers, about close to 500 of them. And they are going to be placed in areas where demographically you have high representation of minority individuals. Also, pharmacies are going to get stocked, including pharmacies in particular areas, regions, locations, neighborhoods that have a high minority. And finally, there will be mobile units that will go out directly to not easy to access areas, as well as increasing the number of vaccinators, people who put vaccine into people's arms. And he's also established an equity task force. And there are people in the White House, Cameron Webb and others, and you have Dr. Marcella Nunez-Smith, who is the chair of the Equity Task Force. So equity is very much on the front burner of everything we're trying to do with vaccines.
Thank you both for answering that, because that is very important. And I think that mayors and council members in all over America get this question about access, distribution in my neighborhood or in another neighborhood, and why is that area being selected over another? And they're trying to come up with answers, and you guys really are, in fact, helping them to address their residents. Let me ask this question to Dr. Walensky. Once residents are vaccinated, we still need to continue with safe practices that I've heard many times that you guys have said the same thing: distancing, wearing masks, avoiding crowds, washing hands. Today, the CDC released guidelines on what activities vaccinated individuals can do. For many people, they see this as, I'd say, a return to normal. Can you help us understand the best way we should be messaging to our residents? Because I do think that that can send a mixed message if we're not clear.
Yes, that's such an important point. So I'm really proud of the release today, but I do want to just convey that this is really a first initial step. We today have less than 10% of the American population vaccinated so far. We're getting there and we're moving really fast, but we still have 90% of people who still have to protect. And as Dr. Fauci earlier said, we still have 60,000 new cases a day. So we are really trying to strike the balance of what vaccinated people can do while also protecting those people who remain unvaccinated. As more people get vaccinated, we will have further guidance. As we follow the disease course in the country, follow the variants and the amount of disease, we will update the guidance. And importantly, as we have new data that continuously emerges to how this vaccine is working in these populations that are vaccinated, we will again update the guidance. For now, what we say is in private settings, vaccinated people can meet with unvaccinated people in their own home without masking or distancing, which is really a really nice way for people to start to be able to do the things with the people that they love. In private settings, we also say that vaccinated people can meet with members of one other household who might be unvaccinated, as long as members of that household are not at risk of severe disease from COVID-19. This does mean that a grandparent who's vaccinated can visit her healthy daughter and grandchildren as long as they are not at risk of severe disease. This is with one other household. So this is, I believe, a real important first step to getting people back to be able to see those who they love and really to get them back toward doing the things that we were doing and enjoying pre-pandemic.
Thank you, Dr. Walensky. And we'll make sure we get that information out to our municipal officials. It is important that, again, the National League of Cities and our members are able to share that. I want to move to both of you on this issue related to public health professionals, because this has been a virus, a pandemic that impacted so many lives and so many professions. And we've seen public health take a significant hit, with estimates of more than 180 state and local public health officials having left their jobs in less than a year, depleting and even stymieing, I'd say, our public health system just when we need it most. With this mounting pressure and threats that our public health officials are facing, how is the administration working to improve public health and the role of local public health officials? What can cities do to support these efforts?
Well, that's a very important and troubling issue that you bring up, Mr. Anthony. Of all of the pandemic outbreaks that I've had to deal with over the 36 years that I've been directing the Infectious Disease Institute, I have never seen a situation that even came close to this with regard to divisiveness over ideology, political ideology, that actually swept over into the issue of public health, where people, as you mentioned correctly in your statement and your question, that health officials who push for common sense, well-accepted public health measures of wearing masks, physical distancing, avoiding congregate settings, including indoor, are actually looked upon as the enemy of getting the economy opened, the enemy of getting people's jobs back, when in fact the common enemy is the virus, not the health officials who are trying to do as best as they can to get this country out of this pandemic grip that we're in. And the way we do that is by adherence to public health measures. And you're right, public health officials have been threatened, and many of them have left their position. The president is very well aware of that and is encouraging everyone to look at this as a common fight. Also, I might mention, the recently passed $1.9 trillion relief bill includes in it a lot of resources that will be helping the local public health officials to do their jobs better. As city leaders, what you can do is please get behind your public health officials. They are totally dedicated to the health of the nation, particularly for you locally, to the health of their community. So please continue to give them your strong, uninhibited support.
Maybe a few things I will add. First of all, I completely echo Dr. Fauci's comment. This virus doesn't know boundaries, doesn't know demographics, doesn't respect borders. This afflicts us all, and so we all have to have a unified approach to fight it. The 2020 report from Trust for America's Health reported that in the last decade, the public health workforce in this country has lost 56,000 jobs. 25% of our current public health workforce is actually expected to retire in the next year. We have a crisis of the volume of people who are even engaged in public health in this country. And that's why I really do believe, given that in the last 10 years, we have seen Ebola, we have seen Zika, we have seen H1N1, and now, of course, we've seen COVID-19. We do need a massive bolstering of our public health infrastructure, our public health workforce, our state epidemiologists who help sort of understand where these outbreaks occur, and then our state labs who actually do the diagnostics and the surveillance to ensure that we know about outbreaks when they happen. That public health workforce has been frail for years, and you saw the manifestations of it being frail in what happened with COVID-19. I am speaking a lot to these societies, the public health workforce, state epidemiologists, public health labs. They need support. They need workforce. They need infrastructure. And so what you can all do is to facilitate the support going to those places. Public health works really well when you don't hear from us, because that means all things have been averted. What you saw with COVID-19 is we did not have the capacity to avert.
No, those points are very helpful. And we're seeing that trend in public office and public service. We're seeing mayors, council members out there trying to get the food and housing, and they're contracting the pandemic, and we're seeing quite a few having terminated their lives because they're out there serving. We will lift up those public health employees and officials, and we will be there to encourage them. I have one final question before we go to the audience questions. How can local leaders help you both and your teams to take this fight to the finish line? Because we know that in order for us to return to what many say normal, we have to be partners with both of you.
Well, you use the word local leaders. So I would say show leadership and get out there and endorse the kinds of things the CDC says, endorse the kind of things that you hear Dr. Walensky and I say on our 3 times a week press conferences. We're doing it because we want to get this country out of this pandemic and back to normal. We're not doing it because we want to slow down things to normal. We're doing it because we know that is the way, the quickest way to get to normal. So we need you. We really do need local leadership to be able to endorse the kinds of things that we say that is based on science and evidence.
There is so much that's critical that's riding on the next 2 months. How quickly we vaccinate versus whether we have another surge really relies on what happens in March and April. And so what I would ask is that local leaders, as Dr. Fauci said, be leaders, demonstrate through their own example and through their own communities, mask wearing, distancing, all the public health measures, demonstrate their willingness and wantingness to get vaccinated, spread the word to local community leaders, and be part of the action that gets us out of this.
Now we have some questions from a few of our members. The first question comes from Mayor Chastity Wells Armstrong from Kankakee, Illinois, a population of 26,000. The mayor says, given the newness of the vaccines, how can local leaders help the public become more comfortable without having longitudinal research to study the potential of side effects? We have a similar question from Councilmember Rebecca Villagrán, San Antonio, Texas, population 1.5 million, as well as Councilmember Ellen Smith from Oak Ridge, Tennessee.
Who would you like to answer that?
I'll ask both of you guys. Jump in, because these officials are excited about hearing from you guys.
Well,
maybe
go ahead, Rochelle. Go ahead.
I know these are new vaccines and they're new to us, but the reason that this was possible is because so much science was happening around these vaccines before COVID-19. These were not started around COVID-19. There was an extraordinary amount of research on mRNA vaccines that preceded 2020 and that made it possible to sort of jumpstart everything with the arrival of the mRNA vaccines. As I mentioned, 100,000 people rolled up their sleeves to enroll in these clinical trials with, well, I would say 100,000 people total. So about 70,000 people in the mRNA vaccine specifically. It's shown extraordinary safety in that time. The reason it was possible is because so many people volunteered so quickly. And in fact, because there was so much disease out there that we could achieve outcomes quite quickly. We have seen that the anaphylaxis, the severe allergic reaction that happens with these vaccines, is happening at a rate of about 4 in a million. That's extraordinarily low and very consistent with what we're seeing in all other vaccines. So, and that reaction is reversible. So what I would say is we know a lot about these already. We have an extraordinary amount of research. We have been doing following this in our VSafe program at the CDC, and tens of thousands of signed. It's the largest vaccine safety program in American history, and so we're following the data carefully, and we just haven't seen concerning signals.
You know, you use the word longitudinal research. People keep asking Dr. Walensky and I, what about these long-term effects that you might be missing since this vaccine has only been involved in being administered for a year? Well, you know, when you look at the history of vaccinology and you talk about long-term effects, not the immediate ones that Dr. Walensky mentioned, such as the anaphylactic reaction, but some unknown bizarre thing that might happen sometime afterwards that you could miss. In the history of vaccinology, when you look at what the FDA and the CDC and others have looked at historically, almost all of the vaccine effects that occur beyond just the vaccination date occur anywhere between 15 and 45 days after the administration of the dose. It is for that reason that the FDA requires that before you allow a vaccine to be given to the American public, you must wait 60 days from the time that 50% of the people in the trial receive their last dose. So you're well beyond historically when essentially all of the long-term side effects occur. That's the reason for the 60-day wait. So in addition to the long-term follow-up that Dr. Walensky mentioned to you, you don't even get a chance to get the vaccine until you have that 60-day waiting period.
This next question is an important question. And it's cities need help getting vaccines straight to their communities to set up mass vaccination hubs that are equitable and not political. How is the federal government rollout, specifically through the FEMA community vaccination centers, working to ensure that mass vaccine sites are in areas most impacted by COVID-19?
So the CDC sits down with FEMA and looks at both census and social vulnerability index, and then the places where these mass vaccination sites could be placed to really hit a large number of people, as well as where those people are maximally, where there's the highest social vulnerability index. From there, they also send mobile units. So they take from the mass vaccination centers, they're really trying to do a whole lot of outreach. And so we really do map where the highest census is with the highest social vulnerability, and then try and do the mobile units from there.
Anything to add, Dr. Fauci?
No, actually, exactly what Dr. Walensky said and what I said in a previous comment about community vaccine centers, mobile units, pharmacies, with the thought in mind that equity must be addressed at every single point.
And maybe one other thing to add, that this past week and a half, we're really rolling out and ramping up our federally qualified health centers, and we really, to over 250 across the country. We really do believe that also, with more vaccine on board, getting to more of those FCCs, will reach more hard-to-hit populations.
Well, let me say thank you to both of you, Dr. Fauci, as well as Dr. Walensky, for joining us this afternoon and sharing your optimism, but also your knowledge with medical officials all over America. And I have to tell you that you are so valued in America. Without your knowledge, without your advice on a daily basis, I don't think we would be where we are in America. And I can tell you that the optimism that America feels right now is because of the information, the science, the data, and the advice that you're giving our communities. And mayors and council members all over America value your advice. So thank you all so much for your time. I appreciate it. And one thing I will say, any person that has the name Anthony in their name, they are really blessed. And I do appreciate you guys every day, as well as you, Dr. Walensky. Just Anthony is a little bit more connected. So thank you all.
Thank you for having us.
Let's welcome back NLC First Vice President, Mayor Vince Williams.
Thank you, Clarence, Dr. Fauci, and Dr. Walensky for such an important discussion on where we are in combating this pandemic. This is a critically important issue. This is a good time to mention that AC is hosting a special vaccine boot camp for us this afternoon. I hope to see you there. All right, my friends, we are officially finished with our first general session. Enjoy the fantastic workshops and evening events, and we will see you back here tomorrow for 2 more general sessions. Have a wonderful afternoon.
Thank you.